Today, we're diving into a complex and often misunderstood condition, Avoidant Personality Disorder, or AvPD. Avoidant Personality Disorder is all about extreme social inhibition, feeling inadequate, and being supersensitive to criticism and rejection. People with AvPD often see themselves as socially awkward or unappealing and avoid social interactions where they fear negative evaluation. Let's break down some key features that define AvPD. Avoiding jobs that require a lot of social interaction. People with AvPD often steer clear of roles that demand social interaction to avoid perceived criticism or judgment, which can limit their career growth. Only getting involved with people if they are sure of being liked. This fear of rejection means they might avoid situations or relationships where rejection is possible, even if the chances are low. Holding back in intimate relationships due to fear of being shamed or ridiculed. Intimacy requires vulnerability, which can be particularly tough for those with AvPD. They fear revealing their true selves will lead to rejection or ridicule. Constantly worrying about criticism or rejection in social situations. Social situations can be a major source of stress. They often anticipate negative evaluations or rejection, making them excessively self-conscious and anxious. Feeling inadequate in new social situations. New social scenarios can be really daunting. Their self-doubt makes them question their ability to handle these challenges, seeing themselves as socially inept, personally unappealing, or inferior to others. This deeply ingrained negative self-view goes beyond low self-esteem and feels like a persistent sense of inferiority. Being unusually reluctant to take personal risks or try new activities because they might be embarrassing. Fear of potential embarrassment makes them highly risk-averse. AvPD deeply affects mental health. Avoidance can lead to feelings of isolation and loneliness, contributing to anxiety, depression, and a reduced quality of life. It limits opportunities for personal growth, career advancement, and forming close relationships. The DSM-5, a manual used by clinicians, provides criteria for diagnosing AvPD. A pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation must be present, starting by early adulthood and indicated by 4 or more specific symptoms. Clinicians diagnose AvPD by combining self-reports, direct observations, and sometimes reports from close acquaintances. They might notice unusual tension or anxiety in social situations, avoiding eye contact, reluctance to share personal experiences, and consistent avoidance patterns. Therapy can be challenging due to fears of judgment or criticism by the therapist. However, forming a strong therapeutic alliance can be beneficial. Let's talk about how therapists work with clients to overcome their avoidant style. Building trust. The first step is building a strong therapeutic relationship. People with AvPD are often afraid of being judged, so therapists need to create a safe, non-judgmental space where clients feel understood and supported. Cognitive behavioral therapy, or CBT, is highly effective for treating AvPD. Therapists help clients identify and challenge their negative thought patterns and beliefs about themselves and others. They work on changing these thoughts to more positive and realistic ones. Exposure therapy involves gradually exposing clients to social situations they fear in a controlled and safe manner. Starting with less intimidating scenarios, therapists help clients build confidence and reduce their avoidance behaviors over time. Schema therapy focuses on identifying and changing deep-rooted schemas or patterns that people develop about themselves and the world. For AvPD, these schemas often involve feelings of unworthiness or being flawed. Metacognitive interpersonal therapy helps clients improve their understanding of their own and others' thoughts and feelings. It enhances self-awareness and helps clients navigate social interactions more effectively. Group therapy can be very beneficial for people with AvPD. It provides a controlled environment to practice social skills, receive feedback, and learn from others' experiences. It can help reduce the fear of social situations and build confidence. Compassion-focused therapy, or CFT, helps clients develop self-compassion, which is often lacking in those with AvPD. This therapy aims to reduce self-criticism and shame, fostering a more positive and understanding self-view. Pharmacotherapy. While psychotherapy is central, some clients may benefit from medication. Antidepressants or anti-anxiety medications can help manage symptoms, but they are typically used alongside therapy. The causes of avoidant personality disorder are varied, involving genetic, environmental, cognitive, and social factors. Childhood experiences of rejection, critical parenting styles, and negative peer interactions significantly contribute to its development. Cultural influences can also play a role in how AvPD shows up and is perceived. AvPD often coexists with other disorders, a phenomenon known as comorbidity. Social anxiety disorder, depressive disorders, other personality disorders, substance use disorders, and anxiety disorders are commonly seen alongside AvPD. Recent research has provided valuable insights into AvPD. Studies have explored its brain activity, the role of early attachment and childhood experiences, effective treatment approaches, and long-term outcomes. These findings help refine diagnostic criteria and improve therapeutic interventions. Managing AvPD requires a comprehensive approach. CBT, Schema Therapy, metacognitive interpersonal therapy, group therapy, compassion-focused therapy, and sometimes medication are effective strategies. Building a strong therapeutic alliance is crucial for successful treatment. Untreated AvPD can have serious implications, like chronic loneliness, professional limitations, increased risk for other mental health disorders, decreased life satisfaction, and even suicidal thoughts in severe cases. Early identification and intervention are critical. In conclusion, avoidant personality disorder can cast long shadows, but it doesn't define your life. With proper support, therapy, and dedication, people with AvPD can lead fulfilling lives. If you or someone you know is struggling with AvPD, seeking professional help is a crucial step towards recovery. Thank you for watching and see you in the next video.